In this final section for the endocrine system chapter, we're going to consider calcium homeostasis. While the previous section considered growth hormone and its effects on the growth of long bones, this section goes back to the ANP1 material in the skeleton also, in the sense that the bones are where we store minerals such as calcium. And here we're going to look at how that's regulated and how a couple of other systems come in to add to that regulation. So to begin consideration of the homeostatic mechanism here, we'll start with the calcium levels in the blood dropping. And when that happens, then the parathyroid gland is stimulated to release its hormone, PTH, or parathyroid hormone. We'll keep using the abbreviation when referring to the hormone. That's released into the bloodstream and will target a few different tissues to carry out its effect of bringing the blood calcium levels back up to normal. In that calcium is stored in the bones, PTH targets bone tissue, specifically the two major bone cells that have to do with where calcium gets into the bone. It inhibits osteoblast activity, but more importantly stimulates osteoclast activity. Osteoclasts are important for breaking down the bone matrix, thereby releasing the calcium from the bone matrix into the bloodstream. But PTH does a couple of other things to help with the process as well. It will also stimulate the kidneys to resorb or pull calcium out of the filtrate more rather than letting it be lost to the urine. It'll also stimulate the production of calcitriol, which is a hormone that helps out with the effects of regulating calcium. And then calcitriol will go on to stimulate the digestive tract, specifically the small intestines, to absorb more calcium from the food and therefore get it into the blood also. As blood calcium levels rise, then the other side of controlling this comes from the thyroid gland. And here the thyroid gland is going to release calcitonin, which is made by the parafollicular cells, not the follicular cells that are responsible for T3 and T4, the normal thyroid hormones, but rather the parafollicular cells. Be careful that you don't get these things confused. The parafollicular cells of the thyroid gland release calcitonin. The parathyroid glands release PTH. And as calcitonin gets into the bloodstream, it'll move to affect its target tissues to help, again, regulate calcium. Calcitonin has pretty much only an effect on the bone, and again, it's going to target the osteoblasts and osteoclasts. It'll stimulate the osteoblasts to take up that calcium from the blood and put it into the bone matrix. It'll also inhibit osteoclasts to be less active and therefore allow more calcium to be stored in the bone matrix. Now, in both of these, the two hormones target osteoblasts and osteoclasts, but probably the greater effect for both is on osteoclasts. By causing osteoclasts to become more active, PTH will tip the mineral storage function of bones into releasing calcium. And by suppressing osteoclast activity, calcitonin will allow more calcium to be stored in the bones. So it's mainly about controlling osteoclast activity, although osteoblasts can be involved to some degree also. Consider this question. When you feel that you've reached an answer, hit the next button to go into the next slide, which will reveal the correct answer. The one item on this list that's not a target of PTH is the intestines. The intestines are controlled directly by calcitriol, which is made by the kidneys in response to PTH's effects on that organ. So there's only an indirect effect from PTH to the small intestines.